Hello, and welcome to Talk to Tony Wilson. Today, my guest is Becky Johnson. She's a 30 plus year respiratory therapist. But right now, I just want to give a special thank you to all respiratory therapists for their active bravery and being one of the up close healthcare workers during this essential time, during this pandemic. Some facilities don't have respiratory therapists, so the ones of you that do, consider yourself lucky. Consider yourself blessed to have a respiratory therapist in your facility that can help give off some of their expertise, especially during this time. But Becky, she is not only a frontline healthcare worker, her family is as well. So let me just speak to Becky right now. Becky, how are you doing today?
I'm good, Tony. How are you?
I'm doing wonderful. Glad to have you on my talk show today. So just give us a
Well,
little background about yourself, how you got into healthcare and into respiratory therapy, especially.
I actually started in respiratory therapy, went to respiratory school straight out of high school. So that was back in the 80s. So I've been working as a respiratory therapist since 1987, and I've been with my current position for over 25 years. So I really enjoy it. I like what I can do to help people and things like that. And I enjoy being a resource for my teammates when I'm at work.
That's wonderful. Okay. Now, I mentioned just in the introductory um, that your family members are essential healthcare workers as well. Um, how does that work? What are they doing in the healthcare industry?
My husband is an emergency medical technician and he works doing interhospital transports. Our younger son actually works with him. Our younger son is also a firefighter EMT. And then our older son, although he's on the medical side, he's also out in COVID as a first responder as a police officer. So we all have been out in it since day one.
Oh my goodness. So back last year at the beginning of COVID, when we first started hearing about COVID, pandemic, the people dying that's catching the COVID, what were conversations like in your family? What did y'all talk about as essential workers? What were y'all's conversations?
Um, we just were talking about making sure we protect ourselves and protect those that are around us. And we've been wearing masks and using hand sanitizer and washing our hands and trying to stay as healthy as we can, eating right, getting enough rest, and things like that, like we normally do, just with an extra level of protection, being a little bit more aware of things to try to keep us from getting it and passing it along to somebody else.
Okay. So kind of much like other people in healthcare, just trying to do what you can to keep yourself safe.
Right, right.
Okay. So we're somewhere along the line, you started having symptoms, and then you later got tested for COVID-19, and you found that you were positive.
Right.
Um, what was going on during that time? Were you able to track where that may have come from, or what was going on during that time?
We really don't know. The beginning of November, my husband was not feeling well, but he has very serious seasonal allergies that usually flare up in the spring and in the fall. So for the end of October, beginning of November, for him to have sinus congestion and not feel well is not that unusual. So this year it was about the same time of year he wasn't feeling well, was having a lot of sinus pressure and thought he had a sinus infection, which is totally the norm for in the spring and the fall with his allergies. He actually went to the allergist and they gave him some antibiotics and some steroids, and he started feeling better for a couple of days, but then was feeling worse. That week that he was sick, my mom had surgery. So I actually was spending the week with my mom, helping her recover from major surgery. And then after spending a few days with her and making sure she was okay, I came home to find my husband at home by himself. Our younger son was at work. Our older son is married, so he's not in the house anymore. But so my husband was home by himself. It was 4:30, 5 o'clock in the evening. All the lights were off, the TV was off, and he was sitting on the couch with his face was beet red, his eyes were glassy, and he wasn't feeling well. So I did my normal respiratory therapy slash wife things and started asking him questions and realized he wasn't feeling well and then realized how severe it was. when I checked his temperature and it was 102.7, and I checked his blood pressure and it was 220 over 110. So at that point, we decided that he needed some immediate attention and I had to call 911. So they came, the fire department and the medics were all in their full COVID gear. And, at that point, he was up moving around in the house, but so he was able to walk outside by himself to get on the stretcher. But luckily, they were able to start an IV in the ambulance before he even got to the hospital. And then he was fortunate too, he was feeling so bad. But the one medic that transported him had mentioned that he had just come back to work after having COVID himself. So I think that kind of reassured my husband that, well, if I do have COVID, hopefully I'll be okay. So we got to the emergency room. They did a few tests. They were concerned about his blood pressure being so high, but his EKG looked okay. And they did a chest X-ray and found out he had pneumonia. The doctor at the time said it didn't resemble what they've been seeing with most patients with COVID pneumonia. So they weren't really sure that's what it was, but they decided to test him anyway, since he had been feeling poorly all week and was still running a fever. So they tested him that next morning. And then the following day we got the results back and found out he was positive. So then that's the next day, then I went and got tested. And then a couple of days after that found that I was positive. And then since I had spent the week with my mom, then we decided to get her tested too. Turned out she was positive. And then 2 weeks later, our younger son that lives at home ended up being positive. My most major symptom was the loss of taste and smell. I had a little bit of a runny nose, a little bit of a cough, but again, I also have seasonal allergies. So my symptoms were exactly like my typical fall allergies. And other than the loss of taste and smell, I felt completely fine. Our younger son, that was his same symptoms, was the loss of taste and smell. My mom never lost her taste and smell, and really, was even with recovering with surgery, and she had a low grade fever a couple of days and sort of was a little bit achy. But she's even said, was that from the surgery or was that from COVID? So she really wasn't feeling that bad. And then recovering from her surgery, it didn't really bother her anymore. So of the four of us, she had the least amount of symptoms. My husband's were the worst. He had, after he got home from the hospital, he was very weak and just had no energy, was still running a fever a little bit off and on. Then after he was home a couple of days, we were in contact with some people that we know that he works with that do home visits. So they actually were able to come to the house and check on him and then call a doctor with the phones that they had from work. And so he was being seen by a physician while he was at home. So they made sure that we had equipment at the house. I had oxygen here if I needed it. They brought a blood pressure monitoring machine, a thermometer, a pulse oximeter to monitor his oxygen. So we were doing all that in the house, and so it worked out. So so luckily I wasn't that sick with it because I was busy taking care of him. But luckily he turned the corner and was doing well and continued to recover. So.
That's one story. That's one long story. I bet it was scary during that time too, wasn't it?
Yeah, because you heard so many stories and then you're so worried, once you find out you're positive, then you think, oh my goodness, am I going to be one of the people that gets really, really sick from it? Fortunately, none of us were. He was the sickest of all of us, and he was in the hospital less than 48 hours. He was feeling better the first couple of days he was home, and then he started feeling worse again. And then once his symptoms were improving, he just had no energy. So then that's when I had to really work with him with getting him up walking and going outside to walk and extending our walks every day. But we took the oxygen monitor with us to make sure that his oxygen levels were staying okay. So it was a lot, but it was nice to have the contact with the virtual healthcare workers. They were able to let us know, to make sure that we kept him well hydrated. That was one of the things they're seeing with a lot of COVID patients, that they're getting very, very dehydrated. So we were doing that. We were making sure that during the day he was up walking around in the house, along with walking back and forth to use the restroom when he needed to. And then one of the things that they really stressed that we had him do was, as much as possible, to sleep on his stomach, which is not what's normally comfortable for him. What he would usually do is, after he got out of the shower and got dressed, then he would lay on his stomach across the bed. And then I would do some respiratory things with him to kind of help make sure he wasn't staying with all that congestion down in his chest. He really didn't have too much of a cough. He just didn't feel good. But by then his temperature wasn't quite as much, so he was doing better. He never lost his appetite though, and he never lost his taste and smell. He just didn't have any energy to do anything.
Didn't I tell y'all you'll be lucky if you have a respiratory therapist? Yes. Okay. So how's the family doing now? Or is there anybody having any of the residual effects, like the excessive shortness of breath during activity, or weakness, any energy loss? Like
No, nope. We're all. Well, my mom's retired. My husband and my son and I are all back to work. Everybody's doing fine. My taste and smell came back exactly 14 days from the day I lost it till the day it came back. Our son is still, I mean, it's been 2 months now, and his is gradually coming back. With talking with some friends who have relatives that are close to my son's age, we found out that their relatives were, the younger people were having a little bit longer of a time to get their taste and smell back. It's an odd sensation because, for a few days there's no taste and smell at all, and then you can taste, like you can identify that something's sweet or something sour, or something salty or something's bitter, but you can't tell what it is. So it was kind of unusual. So, but no, everybody, my husband's back to jogging, and we're all back working. My mom's walking, and everybody's doing fine.
That's good. I'm glad to hear that. So for you, when you were recovered, you didn't just return to work. You actually did more, not to just help yourself, but you did more to try to help other people that may have come in contact with COVID-19. Can you share some of that?
Yeah. There was somebody that I was talking to before I had COVID that had also had COVID and had recovered from it. And they had mentioned that they were in the hospital and they were very, very sick, but they had received plasma from somebody that had already recovered from COVID. So I thought, boy, if I ever got it, that's what I want to do. So after I was feeling better, I researched how to donate convalescent plasma and contacted the Red Cross. And I did go to the Red Cross on New Year's Eve and donated my plasma and my platelets. They wanted to make sure that you were COVID negative, and that you were positive for the COVID antibodies. So I had my a follow-up visit I had with my family doctor. I mentioned that to him, and so I was tested to make sure that I was negative for COVID and that was positive for the antibodies, and I was. So I went to the Red Cross and did a plasma and platelet donation. I actually go back a week from tomorrow for my second time to donate my plasma and my platelets.
So how many times can you go back to donate your plasma, and how do you know if you continue to have the antibodies in your system?
It's with the Red Cross, they do everything is sort of done with their app that they have, which is really nice. You can register and do your screening information with the app. But so then after you donate, then it'll let you know it gives you your blood type, and it also lets you know that if the COVID antibodies were present. So I knew that they were, but then the Red Cross did confirm that I still had the COVID antibodies. So Red Cross would prefer the people that are donating the convalescent plasma to not have the COVID vaccine. So I'm going to continue to donate. They say in about every 28 days to do the donation if you're doing the convalescent plasma. So I'll continue to donate, and then once I don't show antibodies anymore, then I'll go ahead and get my vaccination done. So, but right now I'll keep using the antibodies to donate and hopefully be able to help somebody else.
All right. So each time that you go to give plasma, you're given some of the antibodies that your body naturally builds from having COVID-19. So are you giving away your protection?
No, they said you do. I mean, you do donate some, but your body retains the rest of them, and then you continue to build those.
Okay.
So my levels will maintain what they are, and then every time I donate, then those are gone, but then I'll continue to build my own. So I'll stay protected. So there's no risk of me being unprotected because I donated my plasma.
All right. So I think you said a family member or somebody had COVID and received the plasma before. Did they have that immediate response that I've heard in the news that you could have from receiving the plasma? Did they feel
Yeah,
better instantly, like the
the
flame?
yeah, the person that I did, they said that, they had felt so sick that they weren't sure they were going to make it, and they got the plasma. And the particular person that I talked to said the next day they started to feel better and then continued to improve after that. So this particular person totally said that it was from the plasma donation, the convalescent plasma that they had received that made them feel better.
That is wonderful. Like I say, you not only took care of your husband while you were going through some of the COVID symptoms, but not as bad. You took care of him. It sounded like it was very scary. And then you went back to work, but still, you didn't just go back to work because you were well. You decided within yourself that you just want to help save somebody else from having to go through that what your husband went through. And that is just remarkable. Remarkable. So as far as you know, does the Red Cross contact you, or did you just happen to come across that program and you contacted them?
I contacted them. I actually just did a Google search about convalescent plasma donations, and it listed several different organizations that do the plasma. And I believe it was the CDC website even directed you to the Red Cross. And I thought, well, I've done donations previously to Red Cross. I'm actually in the I've been in the bone marrow donor program through the Red Cross and the for years. So I was familiar with using them and felt pretty comfortable. So I went ahead and did mine through the Red Cross. But there are other organizations that also do the convalescent plasma donations.
You're just a remarkable person. I tell you, that 30 years of respiratory therapy, I know your husband is so happy to have you for a wife. I know he is.
Yeah, every virtual visit he had, he would mention, he's like, well, my wife's here and she's a respiratory therapist. And they were always like, oh, okay, you're in good hands. So
That's what it sounds like. So, is there anything else you'd like to share with us about COVID-19 or respiratory? How we can kind of keep ourselves in good shape, and so even if we do come down with COVID-19, how we might can take care of ourselves?
I mean, the biggest thing is just, to make sure that you're eating right and taking care of yourself, trying to stay as healthy as you can all the time. Exercise and try not to smoke. Eat a fairly healthy diet, get enough rest when you can. If you do come down with it, the main thing they were telling us is make sure you stay hydrated, make sure you continue to eat well, get your rest. And the big thing was making sure you sleep on your stomach. And you also can do, some deep breathing and make sure that you're expanding your lungs and make sure you're up walking around in the house. And then once you're feeling better, you can start walking outside and try to build your strength back up that way.
I'll take that advice. Like I said, she's been in this for 30 plus years. But I went on and looked up the Red Cross telephone number just so I could give it out. And what I did find was a number, it's like a national number, so you can call it from any location and they will direct you to an area in your location that you can connect with. So I'm gonna give you that number right now. Like I say, it's the American Red Cross, and their number is 833-225-8017. That's 833-225-8017. And also their website, if you would just log in, Red Cross Blood COVID Plasma. Red Cross Blood COVID Plasma. Becky, I want to thank you, and I hope others will just listen and take heed to what you did as a healthcare worker and just as a human being, just making those steps to try to save someone else's life. And like I
Oh,
said, again, thank you so much.
oh, you're welcome. Thanks for having me today. It was good to get to talk to you.
All right. Okay. Well, this is going to end another Talk to Tony Wilson. So to all I will say, have a great day.